I think this is a very important issue to discuss in this conference because in several countries of Africa, Latin America, Asia, and even in Europe, there are illiterate people and functional illiterate who cannot understand or follow and perform in usual tests that are usually used in developed countries. So we need to have special tests in order to investigate the possibility of dementia or mild cognitive impairment in those individuals. And it is not usual to have this topic discussed in international conference, but I think it's very important. In the beginning, what they tried to do, what we and other people tried to do, was to reduce the cutoff of tests usually performed in developed countries to diagnose dementia. For instance, in the mini mental state examination, which is a very well-known exam for dementia, the cutoff is 24 or 23 in developed countries. And in countries with heterogeneous educational level, the cutoff was reduced to 18, 19, or even to 13 to illiterate people. So to use the same tests with different cutoff scores. This was the first trial. The first trial was like that. But this is not enough. This is not good, because many people that are not impaired have difficulties in this test because they cannot read, and parts of this test need have questions or topics that need to be read, and they cannot write. And so to simply reduce the cutoff is not a good strategy to diagnose dementia in these populations. This is what we realized when we tried to diagnose dementia in our population. Dementia is characterized by decline in a few in domains, cognitive domains, and or personality or behavior domains. And for the diagnosis of dementia, the person should have a decline in at least two domains. A test should be able to detect these impairments in people with low education. So the test should be able to catch these problems in this population. So we tried to design a test like that in 1994, when we start our experience with a different test that I will present in this conference, in this plenary conference, and maybe I can show it to you now. So I present this sheet of paper with these 10 drawings to the person and ask he or she to say me the names of these drawings. And they are able to, usually they are able to name it. For instance, a shoe, a house, a comb, a key, etc. This is the first test. This is a language test, the ability to name. It's very, very easy, but sometimes people have difficulties in naming, for instance, the turtle or tortoise. They have difficulties, or even the buckle, or the comb. So you can see if they are able to name. This is the first thing. It's very easy. Then I hide this figure and ask, what did you see? Without previous information that I will ask for his ability to memorize. This is the first test that we call incidental memory. After that, I present the same sheet of paper again and say, pay attention and try to memorize it, because I will ask you after that. And after a few, 1 minute, I hide it again and ask, what did you see? I call it immediate memory. And after that, I would give the figure, the sheet of paper again, and say, try to memorize it again. And after that, after a few seconds, 30 seconds usually, I ask, what did you see? And then I have the measure of the encoding, how the learning of the figures, how many they were able to learn. Then I change to two interference tests. The first one is, say me the names of animals. And usually a person can say at least 15 animals in 1 minute. But illiterates say at least 9 animals. You know, it's different. So we have a cutoff or a score, depending on the education level. After that, we ask to the person to draw a clock with the hands, with all numbers, a clock with numbers, and the hands marking 2 hours and 45 minutes. After finishing the drawing of the clock, we ask, what were the figures that you saw a few minutes ago? This is a delayed recall of these figures. The delayed recall is a very good test for memory impairment. Performance 5 or below is strongly indicative of memory impairment, and it is not heavily influenced by education. This is very important, because other tests are more influenced by education than this one. This is a test that is not influenced by education almost at all. And with this test, we are able to analyze language, naming, and verbal fluency by saying animals. We're able to see visual abilities, because you need to see what are these figures in order to say the name. Visual constructive abilities, because you need to draw the clock. And we with this test, we see a lot of abilities that may be lost or impaired in dementia. But for indigenous population, the clock drawing is very difficult. because they are not, it's not usual for them. So we changed it for the stick design test. The stick design test is a test that is that we uses sticks, and the person see this figure and try to reproduce it using sticks like that. And it's easy for indigenous populations. They can do it easily. It's not difficult. So you present once one of these figures, and after that another one, and then another one, 4 of them, one each time to reproduce. And it's easy. It has a very good correlation with the clock drawing test. It is correlated with it. As you can see, the correlation is not very strong, but it is correlated, and this test is less influenced by education than the clock drawing test. After that, we have a recognition test. We show 20 tests, 20 figures, 20 drawings. There were 10 ones and 10 different ones in order to recognize what the ones that were seen before. There are 10 distractors. But this is not so difficult, to recognize the tests is easier for people, even for people with dementia, with mild dementia or mild cognitive impairment. Recognizing is easier when compared to the free recall, which is much more difficult. So we use this test, and the one that we used in Brazil. Recently, a group in Europe has used almost the same test, this same test, using colored pictures. The same pictures, the same pictures that we use, but they use colored pictures. And they use it to examine people that are immigrants. And they found that the recall picture test was the best test to investigate memory in these immigrants in Europe. So I think it is another, I would say, it's important proof of the value of these simple tests. There are other batteries that were designed for evaluating people with low education. But I think that the most important thing is to see each domain by itself, to see the memory, to see language, to see visual constructive abilities, visual ability, perception, and not to see the whole picture. The whole picture, it's important, in my point of view, for following the evolution, but is not as important for the diagnosis. The diagnosis should be based in the evaluation of the domains that are impaired in dementia. This test that I present to you is not heavily influenced by age. It is well performed by aged people too. What I think it's an advantage, but more experience are need to be sure of these. people that more age than 85 or 95, 100 years. We don't have experience with very, very old people to say that they are able to perform it as well as young people. I would like to perform more uh, uh, analyze more people using the stick design test, because we use the stick design tests in indigenous population, but I didn't use it in other scenarios. I would like to try to change the clock drawing test by the stick design test, because the stick design test is less influenced, as I told you, by education. So it will be better to use these tests. But I need to know that if we change the clock drawing test, we remove the clock drawing test, and we put the stick design test in its place, if the cutoff would remain the same, you may suppose that it will be the same, but you need to prove that the cutoff, which is 5 or less for dementia, 5 or less, the delayed recall, because once we try to remove the clock drawing test and perform the test without the clock drawing, what happened? The delayed recall becomes easier because the interference was smaller. If you remove the clock drawing test, the time of interference is less, as the interference is different. And when we did that, the delayed recall was easier. So now, if we want to remove the clock drawing and to include the stick design test, we need to prove that the delayed recall would be the same. It's possible. I would say that is very possible. But in science, in things like that, we need to prove. So this will be my next trial, my next experience in this test. To thank the organizer for asking or for inviting me to present this and to give the opportunity to developing countries to present this topic, which is very important for them. And I would say as you know, most of the dementia patients are in developing countries. So we need to be able to diagnose these people and to use tests that are designed for them.